Miss Jones was excited to be pregnant. She had always wanted a family. When she started experiencing mild cramps, she thought it was normal. Pregnancy can bring discomfort. But the pain intensified. It was no longer just cramps, it was sharp and focused on one side. Worried, Miss Jones took a home pregnancy test. It was positive. Despite the positive test, the pain was not subsiding. It was time to see a doctor. Miss Jones scheduled an appointment with her gynecologist. She described her symptoms, emphasizing the severity of the pain. Her doctor listened carefully, her brow furrowing slightly. The pain was concerning, especially given its location. It didn't quite fit the typical pattern of early pregnancy discomfort. A physical examination was the next step, followed by some crucial tests. The initial examination didn't immediately reveal the culprit. Miss Jones's vital signs were within the normal range for pregnancy. Her blood pressure and heart rate were reassuring. However, the pain persisted and it was becoming increasingly difficult to ignore. The doctor ordered an urgent ultrasound, hoping to gain a clearer picture of what was happening. The ultrasound provided the answer, and it was concerning. The image showed the gestational sac, a small fluid-filled structure that should have been nestled securely within the uterus, but it wasn't. Instead, it was lodged in the fallopian tube, a narrow passageway that connects the ovaries to the uterus. This was a tubal pregnancy, a potentially life-threatening condition. A tubal pregnancy, or ectopic pregnancy, occurs when a fertilized egg implants outside the uterus, most commonly in the fallopian tube. This is dangerous because the fallopian tube is not designed to support a growing embryo. As the embryo grows, it can rupture the fallopian tube, leading to internal bleeding, a life-threatening emergency. The diagnosis was clear. Miss Jones had a tubal pregnancy. Immediate action was crucial. The doctor explained the situation to Miss Jones, emphasizing the seriousness of the condition and the need for swift intervention. The goal was to treat the ectopic pregnancy before it could cause further harm. Surgery was the best option in Miss Jones's case. The procedure, typically performed laparoscopically, involves making small incisions in the abdomen and using specialized instruments to remove the ectopic pregnancy. In some cases, the affected fallopian tube can be saved. However, depending on the size and location of the ectopic pregnancy, removing the tube may be necessary. Miss Jones underwent the surgery and, thankfully, it was successful. The ectopic pregnancy was removed, preventing further complications. While the experience was undoubtedly stressful, Miss Jones was grateful for the prompt diagnosis and treatment that had likely saved her life. The experience served as a powerful reminder of the importance of seeking immediate medical attention when something doesn't feel right. After the surgery, Miss Jones recovered well. She was monitored closely in the hospital for a few days before being discharged home. While she was relieved that the ordeal was over, she couldn't help but reflect on how fortunate she was. Her symptoms, though concerning, weren't necessarily typical of a tubal pregnancy. Some women experience no symptoms at all until the tube ruptures. Ectopic pregnancies are relatively uncommon, occurring in about 2% of pregnancies. However, they are a leading cause of pregnancy-related death in the first trimester. Early diagnosis and treatment are crucial for improving outcomes. Miss Jones's story underscores the importance of listening to your body and seeking medical attention when something feels wrong. Early intervention can make all the difference.